our practice is very much about getting people back to fully functional so that they can do the things that they love and enjoy, but more importantly, they can meet their daily expectation for exercise and they can remain as mobile as possible for as long as possible, because we recognize that movement and exercise is absolutely essential for maintaining and achieving good health. All the tools and resources that we have at our disposal are really designed to repair, not remove, right? And to, improve the function overall of specific joints, whether that's a spine or an extremity, doesn't really matter. And to do that for as long as possible. Now, there's a time and a place for surgery, and we understand what our role is. There is a really big gap in orthopedic injury care. I talk about this quite often in other videos, but at the end of the day, drugs and surgery, these are short-term tools if we're trying to manage pain. There is a time and a place for surgery. When things are broken, surgical intervention is absolutely necessary, and there is no other strategy that will work best for that individual. We have to do surgery, but that's a small percentage of people, especially as it relates to spine complaints. Never do surgery on the spine unless it's tumor infection or instability, tumor or growth, right? Because the clinical outcome when we go in and try to cut things out to relieve pain, the clinical outcome may be good in the beginning stages, but what we see long term is advanced degenerative change and the likelihood that we'll have to take part in surgery down the road and use medications to manage symptoms, right? So orthobiologics, or the practice that we work in, or the paradigm in which we work, is we want to employ as many tools as we possibly can to help us achieve our goals. And previously, even with biologics, traditional biologics that can help to repair and regenerate tissue in a really unique way, we were limited because if somebody came in with a really large disc herniation with radiculopathy, there are risks associated with not being able to treat that, right? Because if a nerve is pinched for long periods of time, yes, it's painful and it hurts, but we can develop weakness and neurological deficits that you may not be able to recover if that's left in place long term. So now with Discseel, we have the ability to, again, use that tool in a paradigm where we're repairing and regenerating actual tissue. And the good news is it's highly effective, right? There are lots of published long-term studies where they looked at Discseel patients or patients who underwent a Discseel procedure, and even after 3 years, they're still seeing significant changes in their symptomatology. And these are prestigious journals like Pain Physician. We're just seeing really great clinical outcomes. It's just another tool in the bag so that, we now have the ability to affect really significant disc herniations where we don't have to subject people to, or they have an option, let's say, to not have to have the disc cut out. Presentation is key, and whether they're patient with a simple disc herniation or a post-surgical case, obviously we have to look at the factors that are contributing to their symptoms. With the post-surgical cases, the biggest issue that we see is that, even in the minimally invasive discectomy procedures, which are really popular, they're laparoscopic. They have a small hole where they can go in and just cut a portion of the disc out. In those particular cases, we see a lot of recurrent disc herniations. What a recurrent disc herniation is basically at the same segment. Because we're cutting the annulus, then what happens is it's allowed to herniate again, right? So it's almost as if we really didn't do any work at all. Or more importantly, there can be other segments that are affected. So if somebody has 2 or 3 disc herniations, you're not going to go in and cut all 3 of those out in most cases. We're going to find the one that's creating the leg pain and we're going to work on that one, but that leaves the other 2 to possibly degenerate over time, because those things don't go away on their own. So there are a wide variety of ways in which we can help individuals, whether it's early on in the process, like with Celia, she's a perfect example. She's a competitive athlete. She's a triathlete. So she knew she wanted to get back to doing those things. I mean, that's what she lives for. And, for her, the decision was relatively easy. I'm glad we were able to give her access to this type of care, right? But essentially, for that individual, she knew right off the bat that surgery wasn't the answer for her. She wanted to get back on the bike. She wanted to get back doing what she loved. And we were able to accomplish that. Within a 3-week period after procedure, she was back competing. Not that, that was something that we recommended that she did, but she did it anyway, and she was able to do it pain-free, which was fantastic. And then you have the individual who's had back pain for many, many years, has tried many, many things. Maybe their overall health is not fantastic, and they've only been given 2 choices, drugs or surgery, and eventually that leads to a surgical visit because drugs typically don't fix problems. So in those individuals, if they still have residual pain and dysfunction that's coming from some level of damage in their spine, whether it's the discs above or below the fusion, whether it's the posterior compartment as discussed in terms of the arthritic process that may have developed as a result of that. Regardless, Discseel is an ideal tool to help us repair discs, and then we have other tools designed to help repair the other tissues as well. So it is a minimally invasive procedure. However, we are putting needles into a disc. So what we do is we use what's called conscious sedation to make it as comfortable as possible. Conscious sedation allows us to get through the procedure relatively easily with minimal discomfort to the patient. And that's really the best way to do things, at least in this environment. Yeah, so the duration of the procedure will depend on complexity. If there are multiple segments that are involved, that's obviously going to take a little bit longer, but just account for about an hour to possibly 2 hours, depending on the level of complexity. With a Discseel procedure, it's a little bit different than some of the other things that we do. So post-procedure, we have to be very deliberate. The fibrin that we inject into the disc has to work with your body for a period of time in order to seal and develop some level of structural integrity. So there's a dependence on how much time that's going to take. With a procedure like this, there is no real downtime or recovery for that matter, because we're not cutting anything out. So we don't need bed rest. You can resume normal activities immediately following. The only recommendation that we make is don't do anything extremely strenuous for the first 4 weeks. We want to allow that Discseel procedure to take. And then also what to expect from that point forward is you're going to see consistent healing over a period of at least 6 months. So we're going to see incremental improvements as time goes on. What we find immediately following the procedure within a 2 to 3 week period is we start to see resolution of the discogenic pain. And in many cases, if there are pinched nerves, we start to see that tend to reside over time because we're affecting the disc first. That's probably the quickest amount of repair that takes place. But with other biologics that we implant, it does take a little bit longer for those things to have an effect. So really, it's just about, making sure that the patient understands exactly what we did from an education standpoint, and understand also that, look, it is a time-dependent process. Healing is a time-dependent process. It is not a one-time event. The best part of the healing process is that once things do heal, the symptomatic reduction and the improvements in function that you experience typically don't wear off. It's really based on kind of what we're dealing with when the patient comes to see us, right? So again, in a young individual with a simple disc herniation, radiculopathy, we would expect that patient to experience significant long-term outcomes, right? Especially once we get to a point where their symptoms resolve, we can do the physical therapy and the structural rehabilitation necessary to stabilize the area. And it's also based on their activity level, right? If you're running triathlons 4 times a year, or you're running ultra marathons, obviously, that individual is a little bit different than, somebody who sits in an office all day. With that being said, if they come to us with significant degenerative changes, the outcome may not be as long. Maybe we get 3, 5, 6, maybe 8 years worth of relief. But with that particular individual, they've been suffering typically for so long, and there's limitations to matter in those circumstances where you can't unboil hard-boiled eggs. So we do the best we can to provide them with a resource on 2 fronts. One is to help reduce symptoms by repairing and providing a healing resource to the tissue that's creating the symptom, but also preventing things from continuing to degenerate past that point. We talk in terms of risks predominantly because many of the biologics and tools and resources that we utilize don't really have any side effects, right? A lot of them come from the body. With the Discseel procedure, we are using something from the outside, but it's an FDA-approved product that's been used for many years in general surgery and hasn't been shown to have significant side effects within the body. In terms of risks, we are puncturing skin, we are injecting discs, so there are relative risks associated with the procedure itself, although very small. The last thing we want is to have any type of adverse event associated with the procedure that we do. And in 15 years, we've never had an infection. So, I'm proud to say that because we just take great care and, above all, do no harm, right? Discseel or regenerative medicine is really simple. It's all about repair, not removal. Removing tissue to solve for pain doesn't really make a whole lot of sense long term. right? We have better tools. This video may bring up a lot of questions, and if you have some, go ahead and leave some in the comments. I'm happy to answer. Or if you have detailed questions about your specific condition, you can reach out to our office, and we're happy to answer them.